We are happy to have with us today Senator Kamala Harris. Senator Harris completed a very comprehensive questionnaire that's on our website that you can have access to that details her biography. But my quick summary is Senator Harris grew up in Berkeley, went to Howard University, first ran for office and became the district attorney in San Francisco, subsequently ran for attorney general in an extremely competitive race that was days and days of counting with this union support and virtually every union support. Subsequently got reelected, and then in 2016 ran for the United States and Senate, and our union supported her in both the primary and the general. Welcome, Senator Harris. Before you answer a few questions from our leaders, if you could take a minute or two to talk directly to our members, that would be terrific.
Yeah, thank you, Sal. And I just want to first thank everybody. You have stood with me for years. We have stood together for years. We have marched together. We've been in battles together. And I'm just so thankful for the members of UHW, for the leadership of UHW. You've been with me when people thought I could never win races. And we got out on the streets, we took it to the streets, and we fought together. When, going back to when I ran for DA, that was in 2002 when I filed those papers. That election was in 2003. And I was campaigning on a campaign that was about we can reform the criminal justice system. And people didn't want to hear that. They wanted to hear prosecutors saying you were going to put people in jail. But you guys stood with me when I created one of the first in the nation programs to get people who had been arrested for drugs, get them jobs and get them counseling. You stood with me when we were in battles about saying that we are going to support organized labor and the right to strike. You stood with me when I said I'm not going to charge people disorderly conduct when they are protesting. And then you stood with me in that AG's race and the Senate race. So I'm very thankful to everybody for all that you do. And, listen, this is about standing together in the face now of a moment in time where organized labor is under attack like never before, and at the national level. And part of what UHW has always done is hold it down, not only for California, but for the whole nation. This is about national leadership that has been about always fighting for the rights of working men and women, and fighting also because it is your members that are lifting up the families of America and giving folks dignity and giving them support. And recognizing the dignity of labor, the dignity of work. And so I want to thank you all for that. And I will always stand with you because in my bones, in my heart, in my core, I know that if we are ever going to have a nation that recognizes the dignity of work and the importance of that work, we have got to support organized labor and its ability to fight for the rights of working people. So I thank you.
Good morning. My name is Ruth Keys, and I'm a phlebotomist at Children's Hospital in Oakland. And my question is, do you support a publicly financed Medicare for All system that will eliminate private insurance in providing comprehensive health coverage? If so, what steps will you take to overcome the opposition for such sweeping reforms? And if not, why not? And what's your alternatives?
Thank you. And thank you, Ms. Keys. And I'll tell you, I've spent a lot of time at Children's Hospital in Oakland for a number of reasons, including the work that we've done together around dealing with issues like childhood trauma and what we need to do to address that. So thank you for your leadership and for the work of your members at that hospital. I support a publicly financed Medicare for All system. I've always been for Medicare for All, and I'm offering a proposal that is Medicare for All, that is about making sure that we bring costs down by holding the insurance companies accountable and holding their feet to the fire, eliminating copays and deductibles. What we need to do to ensure that there's going to be coverage for all people, including those with pre-existing conditions. My plan is about saying that we are going to give people choice. So if the private insurers want to compete under our plan, they can, but they are not going to be able to charge copays. They're not going to be able to charge deductibles. Under my plan, I'm also giving a 10-year transition period because, frankly, I've been listening to people since I've been campaigning, and in particular, the brothers and sisters of labor who have been saying, Kamala, don't take away our opportunity to hold on to the plans we've negotiated when we negotiated to keep wages stagnant or even make them lower so we could get greater healthcare benefits. We don't want to have to give that up. And so that's part of my plan, which is to give folks a 10-year transition period for those, in particular in organized labor, who've negotiated their plans. But the bottom line is this. Healthcare has got to be a right and not a privilege of just those who can afford it. There are currently 30 million people in the United States who do not have coverage. I have spent time in places like Highland Hospital, in San Francisco General Hospital. I have seen what happens when we do not have a healthcare system that allows all people to have access regardless of cost. Because what ends up happening is folks, poor folks, people of color, end up getting their healthcare in the emergency room in a moment of crisis. It is inhumane, it is irresponsible, and it is wrong. And we can do better. And that is why I am in support of a public Medicare for all system. It gives people choice, but that brings the pharmaceutical companies and the insurance companies to be accountable for what they've been doing in jacking up prices, jacking up copays and deductibles. And I'll remind you guys, as Attorney General, I took these guys on. I took on the pharmaceutical companies. And you know, there are a lot of people who talk about what should happen. I've actually taken them on and won. And I'm prepared to do that as President of the United States.
Thank you.
My name is Shay Loftus. I'm a psychologist with the Kaiser Permanente Psychiatry Department in Fairfield. My question for you, as president, what would you do to make mental health parity a reality and to ensure that all Americans can get timely and appropriate mental health and substance use disorder services?
Thank you, and thank you for your work. You guys probably remember the work that we did together back in the early 2000s and leading up to today around issues like undiagnosed and untreated trauma among children growing up in communities where there's violence, in homes where there's violence, or children growing up in poverty, because we all know poverty is trauma-inducing. And I'm proud of the work that we've done together over decades, frankly, of putting a spotlight on this in terms of the need to get mental health services to all communities and all ages and generations of folks. And so this is an issue that I care deeply about. It's an issue I've worked on for a very long time. And here's my solution to some of the problems. One, it's going to be through our Medicare for All plan, which is going to ensure that there is coverage for all people to get access to the kind of care they need, both in terms of diagnosis and treatment, and also in a culturally competent way. Because there is a component of my plan that also addresses what we need to do around minority serving institutions, HBCUs, to also encourage folks to be trained with the resources they need so that we can have the pipeline of people who are performing these services reflect the communities that need the services. Also, I have recently released a plan that is about veterans. California, we have the largest number of veterans of any state in the nation. And in fact, we have more veterans in California than there are active service men and women around the globe. And what we know is that nationally, 20 veterans a day commit suicide. And a large part of that is because we are not giving them the treatment they need. So there's a big part of my plan that is about that, both based on what we can do through the VA, but also what we can do through the community and through the institutions that UHW serves. Telemedicine, big issue. There are so many that just is there, but we all know, and you all have been a champion in saying telemedicine is a really good second alternative. And so part of my plan is about that. It is also about healthcare and substance abuse treatment and mental health care on demand. So the same way that folks can walk into an emergency room, they should not have to go through a bureaucratic process and a wait list to have access. It should be on demand. And then finally, I'm also proposing a loan repayment program for mental health professionals. Because we have so many folks who, come from the communities that need the assistance and pursue this profession out of a deep desire to serve, but are burdened with loans, and which makes it difficult for them to see it through or to even stay in the profession. And so there is that in terms of my component of what we're doing, especially targeting those mental health professionals who go into the communities that are in highest need.
Thank you.
Great, thank you. My name is Jackie Shallot.
Oh, I just want to say one more thing,
Sure,
because
sure.
it's I could go on and on with all these things, but part of the problem is that the way that I think about it, we have treated the need for mental health care. We have this is one of the biggest failures in the public policies of America, because we deal with everything that is about the body from the neck down, and we neglect the body from the neck up. And when we talk about what ends up leading to the things that then we are dealing with in a system of incarceration, and I know this as a prosecutor, it is criminal. It's criminal. And so that's how I think about this issue also. And sorry to interrupt you. Okay, we can keep going.
No, thank you very much. My name is Jackie Shallot. I'm an infant parent psychotherapist who worked with babies impacted by incarceration and substance abuse at Children's Hospital Oakland.
Great.
My question is, what are the most important reforms you would pursue to help revitalize the labor movement and begin reducing the vast inequalities of income, wealth, and life chances among Americans?
Yeah. I don't have to tell anybody here that America's economy is not working for working people, and it has not been for a really long time. Today in America, almost half of our families cannot afford a $400 unexpected expense. Today in America, in 99% of the counties, if you're a minimum wage worker working full-time, you cannot afford market rate for a one-bedroom apartment. Last year in America, 12 million people took out a loan of on average $400 from the payday lender at an interest rate often in excess of 300%. It's crazy. Meanwhile, you've got the members of the Walmart family who in 60 seconds make more money than the average American family does in a whole year. Meanwhile, you have 60 of the biggest corporations of America who last year paid no taxes. Who in this interview paid no taxes last year? It's wrong, and we've got to correct it. So being more specific, what part of my proposal is what economists are describing would be the largest middle class tax cut we've had in generations. I'm proposing we deal with this in a number of ways, income inequality and the inequities, partly by dealing with it through the tax code. So I'm proposing for families that make less than $100,000 a year, they get a tax credit that they can take home at up to $500 a month, which is all the difference between families being able to get through the end of the month with dignity or not. Also on the issue of organized labor, we all know this. Organized labor built the middle class of America. You do not have to be a member of a union to have benefited from the work of organized labor. It is you that brought us the 8-hour workday, the 5-day work week, sick leave, and all of the benefits that should come with working a hard day's work. But it's full on under attack. And again, I've been traveling the country now, and I'm going to states with these right to work laws. I'm going to states where there's a full on attack on organized labor. And as President of the United States, knowing that, and knowing the importance of supporting working men and women, I promise you, as I've always been in every office I've held, and you guys know this, I will be a voice of support for organized labor, and I will fight for the rights of organized labor. We all just stood together in Los Angeles recently with the healthcare workers for Labor Day, talking about just these things, which is what we need to do to recognize the attacks and to stand with labor, even when it may be difficult, even when it may not be popular, even when there may be strong forces against that. I will always, as I always have, stand with organized labor. Specifically as president, I will work against the right to work laws. I will strengthen the laws about right to strike. I will ensure that we also strengthen enforcement around wage and hour violations, as I've done when I was Attorney General and even when I was DA. I will do the work of appointing judges for these lifetime appointments, including to the United States Supreme Court, that recognize the long legacy and history of legal support based on the Constitution of the United States. for labor and the right to organize, and for working men and women to be able to have the collective stand with them so they don't have to stand alone against a powerful employer. I will appoint a Secretary of Labor who understands labor, who comes from a background of working with labor and in labor. Because there is no ability of somebody to be able to lead this discussion if they've not been in it and they don't see it from the ground up and from the inside and understand what's at stake. And truly, the future of the economic strength of this country is at stake as much as anything else. And people need to recognize that. You want to have a healthy economy? That means healthy families who are working a full day of hard work and can and get the wages and benefits that come with the value of that work, which is immense. So, and of course, a $15 minimum wage.
Thank you.
But understanding though, that's a minimum. That's a minimum. That's a minimum standard of living. It's minimum. Let's not forget when we talk about minimum wage, it's minimum. It's the floor, not the ceiling.
Thank you
Okay.
very much.
Hi, my name is Greg Luna, and I work at California Pacific Medical Center in San Francisco as a cook.
Yeah.
President Trump has attacked immigrants and provoked racism against people of color in ways that divided working people and threaten our safety. As president, what major steps would you take to advance immigrants' rights, diminish racial disparities, and build solidarity in our nation?
Yeah, that's right. I say everywhere I go, regardless of who the audience is, what they look like, what state I'm in, whether it has a background with, the large immigrant population or not. But here's what I say, just to make everybody clear about this point. We are a nation of immigrants. And unless you were Native American or your ancestors were kidnapped and brought over on a slave ship, your people are immigrants. So let's come correct when we're having this conversation. It is immigrants who have helped to build the strength of this nation. And what we have in Donald Trump is a president of the United States who is engaged full-time in vilifying immigrants, in xenophobia, in racism. You look what's happening just most recently. But the Bahamian, the father from Bahamas, who's trying to get on basically the equivalent of a life raft, a ferry, with his toddler to protect that child and make sure that she is going to be able to drink clean water and have a roof over her head, and denying access. You look at what's happening in terms of the people who are fleeing the murder capitals of the world in Central America. I always say to people, just step back. If you're a parent, if you've ever parented a child as an auntie or uncle or grandparent or anything, when a parent decides to engage in this perilous track of leaving the only place they've known, to go through an entirely new country, in this case, the country of Mexico, with unknown peril, why would they do that? Because they know if they stay where they are, it is even worse. And then what does this administration and Donald Trump do? When they arrive, tell them, go back to where you came from. It is inhumane. So I will always stand strong on this issue. I have, both in my years as DA, as Attorney General. As you all know, we worked together around the unaccompanied minors to make sure they got legal support and assistance and dignity. And as president, I promise you, this will be one of my highest priorities. And it goes as follows: to pass comprehensive immigration reform with a pathway towards citizenship. Also, I think I'm the only one on this debate stage and in this election who has also said, I'm prepared to take executive action as it relates to our dreamers and our to give DACA protection to the 6 million people. That would include not only the DACA recipients, but their parents, their family members, and also veterans. And I want to make that as a point of emphasis, because DACA was all about the kids. But you know what those kids want? They want their parents. And we cannot have social justice policy that so typically happens in our country, that is paternalistic, in a way that thinks, okay, we'll take care of the cute kids, but not the parents. No, those kids want their parents rightly. Their parents love them. So part of my focus is also on protecting the parents. In addition, it's going to be about asylum seekers and a meaningful process for asylum seekers. And then what we need to do around closing the private detention facilities, which I'm prepared to do immediately. I visited Homestead in Florida, a private detention facility that currently houses 2,700 children for profit. I'm prepared to also, as I've called for TPS, temporary protected status, for those fleeing Venezuela. Also, that needs to happen in terms of those that are fleeing the disaster that took place in the Bahamas. So these are some of the things that I'm prepared to do.
Thank you.
Thank you, Senator Harris, for those answers. If you could now take a couple of minutes to any final thoughts or closing remarks for our members, that would be terrific.
Yeah, thank you, Sal. Listen, you guys and the members of UHW and UHW, you guys are the backbone of our healthcare system. You're the backbone of our healthcare system. You make the system real. And it is everything from the work that you do as cafeteria workers, as groundkeepers, as janitors, as psychologists, as the mental health care workers across the spectrum. You're the ones who make real the healthcare and the promise of the healthcare system. You're the ones when people walk through the doors of, be it Children's Hospital, be it Highland, be it SFGH, you're the ones who are there to receive people and care for them and put the structure around what should be a promise from a civil society and a society that cares about human beings. You're the ones to make real that promise every time people walk through those doors. And in some ways, the work that you do is the work that people just don't think about in terms of the detail of what goes into it. That's an incredible commitment that you make to do the work you do. You're dealing with people who are sometimes at the lowest point in their lives in terms of the pain they're experiencing, the desperation they feel, their need for some other human being who is not a family member to care for them and look in their eyes and give them dignity. You do that work every day in every one of those positions I mentioned. And so I honor you for the work you do. I thank you for the work you do. And I look forward to continuing to work with you. And thank you for this opportunity to speak with you today.
Yeah, and thank you for your time. Much appreciated. Best of luck to you on the campaign trail. Stay healthy and come see us when you're back in California.
I look forward to it. Thank you guys very much. Thank you, all of you, everybody.
Thank you.
Thank you.
Thank you.